As a neurologist, I must tell you something that may surprise you. Stroke is often described as a sudden event, striking without warning. Yet in many cases, the body gives signals days or even weeks before the attack occurs. Ignoring these warnings is one of the most dangerous mistakes people make. More than half of all strokes happen outside of a hospital setting, which means recognizing these early signs could save your life or the life of someone you love. The brain is an organ that cannot survive long without oxygen. And when blood flow is interrupted, millions of cells die every minute. But the process leading up to that crisis often begins quietly. Episodes of dizziness, sudden weakness in an arm or leg, blurred vision, or difficulty speaking may appear briefly and then disappear. These are not harmless incidents. They can be signs of a transient ischemic attack, often called a mini stroke, which is one of the strongest warnings that a major stroke is coming soon. Some people describe dropping objects without explanation, stumbling while walking, or suddenly being unable to write clearly. Others recall moments when their vision went dark for a few seconds, as if the lights had gone out. These are red flags that should never be ignored. The danger is real. But so is the opportunity to act early. If you know how to recognize these signals and respond quickly, you can prevent permanent damage. In this video, I will explain the early warnings, the medical reasons behind them, and the steps you must take to reduce your risk. Before we continue, I want to hear from you. Have you or someone you know ever experienced sudden dizziness, numbness, or loss of speech that quickly returned to normal? Share your experience in the comments. Your story may help others recognize a silent danger before it turns into a life-changing stroke. 1. Transient ischemic attack as a warning sign. One of the most important signals the body gives before a full stroke is something known as a transient ischemic attack, often called a mini stroke. Many people misunderstand this condition because the symptoms fade quickly and leave no lasting damage. They assume it is harmless. In reality, a transient ischemic attack is one of the strongest and most urgent warnings that a major stroke is likely to occur soon. Understanding what it is, how it feels, and why it must never be ignored is critical to protecting your brain. A transient ischemic attack happens when blood flow to a part of the brain is briefly interrupted, usually by a small clot. Unlike a full stroke, the blockage resolves on its own within minutes and circulation returns. Symptoms typically last only 10 to 20 minutes and almost always resolve within an hour. That short duration is why so many people dismiss it. But the underlying danger remains. The event proves that the blood vessels feeding the brain are vulnerable and that clots are forming. Without intervention, it is only a matter of time before one of those clots causes permanent damage. The symptoms of a transient ischemic attack are often identical to the early signs of an ischemic stroke. Sudden weakness or numbness may affect the face and arm or leg, usually on one side of the body. The mouth may droop, a smile may look uneven, or an arm may feel heavy and unresponsive. Speech can be slurred. Words may be jumbled, or the person may be unable to repeat a simple sentence. Vision changes are also common, with blurriness, double vision, or temporary blindness appearing out of nowhere. Some patients experience sudden dizziness, loss of balance, or difficulty walking. Others report a mild headache, confusion, or a brief episode of memory loss. In rare cases, seizures may occur. The critical detail is that these symptoms appear suddenly and disappear quickly. That disappearance is what makes a transient ischemic attack so deceptive. The brain does not hurt, and once the function returns to normal. People convince themselves that nothing serious has happened. This is a dangerous mistake. Medical studies show that up to 1/3 of people who suffer a transient ischemic attack will experience a full stroke within the next year, many within days or weeks. The mini stroke is not an isolated event. It is a loud alarm bell. Imagine your brain as a city and the blood vessels as highways. If a truck jackknifes and blocks a lane, traffic stops for a short time until the truck is cleared. The cars begin to move again, and drivers think everything is fine. But the real issue is that the road is too narrow and poorly maintained, and another accident is inevitable unless repairs are made. In the same way, a transient ischemic attack is proof that your arteries are unstable and that the risk of a full blockage is high. Immediate medical attention is essential. If you or someone near you experiences these brief episodes, do not wait for them to happen again. Seek emergency care. Even if the symptoms vanish, doctors can perform brain imaging, blood tests, and heart evaluations to identify clots, vessel damage, or rhythm problems that cause the episode. Treatment may include medications to thin the blood, control blood pressure, or reduce cholesterol. In some cases, procedures to remove plaque from arteries or repair vessel damage may be necessary. Taking action after a transient ischemic attack can literally prevent a life-changing stroke. It is also important to recognize that some people experience subtle warnings that are easily overlooked. Dropping utensils during a meal, suddenly writing with poor control, or forgetting familiar names may all reflect short interruptions of brain function. These events may last seconds, but they matter. They are not signs of clumsiness or aging. They are signs of vascular compromise. Do not minimize them, and do not delay evaluation. If you have a history of hypertension, diabetes, or high cholesterol, you must be especially cautious. These conditions make your arteries more fragile, and a transient ischemic attack in this setting is an urgent red flag. Think of the mini stroke as your body's way of pleading for help. It is not the crisis itself, but the final warning before the crisis. Responding quickly gives you the chance to change the outcome, to preserve independence, and to prevent the devastating consequences of a full stroke. 2. How stroke is diagnosed and treated in the golden hour. When a stroke strikes, time is the single most important factor. Neurologists refer to the first 4.5 hours as the golden window, the period when treatment can restore blood flow to the brain and prevent permanent disability. Every minute that passes, nearly 2 million brain cells die, which is why speed in diagnosis and intervention makes the difference between recovery and lifelong dependence. Understanding how stroke is diagnosed and treated in this critical window may one day save your life or the life of someone close to you. The process begins the moment a patient arrives at the hospital. Doctors immediately perform a clinical evaluation, asking about the sudden onset of symptoms, checking muscle strength, speech, vision, and coordination. But clinical observation alone is not enough, because different types of stroke require very different treatments. The crucial step is brain imaging. A CT scan or MRI allows physicians to see whether the stroke is caused by a blocked artery, known as ischemic stroke, or by bleeding inside the brain, known as hemorrhagic stroke. The distinction is essential, because giving clot, dissolving medication to a patient with a brain bleed would be fatal. Only imaging can provide certainty, which is why rapid transfer to a hospital equipped with scanning technology is so critical. If the scan confirms an ischemic stroke, doctors may administer a clot-dissolving drug called a thrombolytic. This medication works by breaking apart the clot and reopening the artery, restoring blood flow to starving brain tissue. The effectiveness of this treatment is highly time-dependent. The earlier it is given, the greater the chance of full recovery. After the golden 4.5 hours, the risks of bleeding outweigh the benefits, and the opportunity is lost. In some hospitals, specialized teams can perform mechanical thrombectomy, a procedure in which a catheter is threaded into the blocked artery and the clot is physically removed. This treatment can extend the window up to 24 hours in certain patients. But again, earlier is always better. If the scan reveals a hemorrhagic stroke, the focus shifts to controlling bleeding and reducing pressure inside the skull. This may involve medications to lower blood pressure, reverse blood thinners, or surgical procedures to repair ruptured vessels and remove pooled blood. Unlike ischemic stroke, there is no drug that can dissolve bleeding away. The treatment depends on stabilizing the patient, stopping the hemorrhage, and preventing further damage. Beyond these immediate interventions, doctors also order additional tests to identify underlying causes. Blood work may reveal diabetes or cholesterol problems, while heart monitoring may detect atrial fibrillation or other rhythm disturbances that send clots to the brain. This step is vital to prevent a second stroke from occurring. The golden hour is not simply a phrase. It is a reality, measured in living neurons. Each delay, whether in recognizing symptoms, calling emergency services, or transporting the patient, costs precious brain tissue. This is why public education is so important. People must understand that stroke is an emergency equal to a heart attack, and any suspicion of symptoms requires immediate medical attention. Do not wait to see if weakness passes. Do not drive yourself to the hospital. Call emergency services so trained personnel can begin life-saving measures on the way. Even with the best treatment, some patients will face long recovery. But those who receive care in the golden window have dramatically better outcomes. Many can return to independent living, while those who miss the window often face permanent paralysis, loss of speech, or death. The difference is time. Remember this simple truth. Stroke is treatable, but only if diagnosed and managed immediately. Knowing how doctors use imaging, medication, and procedures in those critical first hours should inspire you to act without hesitation if you ever see the signs. Quick action does not just improve survival, it determines the quality of the life that follows. 3. How to reduce your risk through prevention. While medical treatments during the golden hour can save lives, the most powerful protection against stroke comes long before an ambulance is ever called. Prevention is the key, and it begins with the choices you make every day. Stroke is not entirely unpredictable. Most of the major risk factors are well known and controllable. By addressing them early and consistently, you can dramatically lower the chance that a clot or a bleed will suddenly steal your independence. The first cornerstone of prevention is blood pressure control. High blood pressure is often called the silent killer because it rarely causes symptoms, yet it relentlessly damages the walls of arteries. Over time, this pressure weakens vessel walls and makes them prone to rupture. It also encourages clot formation that can block circulation to the brain. Regular monitoring and keeping blood pressure within a healthy range through diet, exercise, and if necessary, medication, is one of the most effective ways to prevent both ischemic and hemorrhagic strokes. The second key is managing blood sugar. Diabetes accelerates the process of atherosclerosis, where fatty deposits and cholesterol build up inside arteries. This narrows the passageways and increases the chance of a blockage. If you live with diabetes, strict control of blood glucose, regular checkups, and adherence to prescribed medication can greatly reduce your risk. Similarly, maintaining healthy cholesterol levels prevents the formation of dangerous plaques. Eating less saturated fat, more fiber, and using medications when prescribed can stabilize artery walls and keep blood flowing freely. Avoiding tobacco is another non-negotiable step. Smoking doubles the risk of stroke because it thickens the blood, damages vessel linings, and accelerates hardening of the arteries. Even secondhand smoke carries danger. Quitting smoking brings immediate benefits, with risk beginning to decline within weeks and approaching that of non-smokers after several years. Alcohol also requires attention. While small amounts may not harm everyone, excessive drinking raises blood pressure, disrupts heart rhythms, and increases the likelihood of both types of stroke. Limiting intake or avoiding alcohol altogether is a crucial part of prevention. Lifestyle choices surrounding diet and activity matter just as much. A balanced diet rich in vegetables, fruits, legumes, lean proteins, and whole grains supports vascular health. Reducing salt lowers blood pressure, while cutting back on sugar and processed foods helps control weight and blood glucose. Hydration with water rather than sugary beverages lightens the burden on the cardiovascular system. Coupled with this is the importance of regular exercise. Just 30 minutes of brisk walking most days of the week improves circulation, strengthens the heart, and reduces stress. Activities like swimming, cycling, yoga, or Tai Chi also support balance and flexibility, protecting against falls that can complicate recovery if a stroke occurs. Prevention also requires awareness of your weight. Obesity is strongly linked to hypertension, diabetes, and cholesterol problems, all of which feed into stroke risk. Setting achievable goals for weight management through diet and exercise is a practical way to ease pressure on the heart and arteries. Stress control and mental health should not be overlooked. Chronic stress floods the body with hormones that elevate blood pressure and damage vessels. Simple techniques such as breathing exercises, meditation, or time spent in nature can restore balance. Social connections play a role as well. Loneliness and isolation not only increase depression but also raise the likelihood of poor habits like inactivity or unhealthy eating. Staying engaged with family, friends, and community can indirectly reduce stroke risk. Finally, routine medical checkups are indispensable. Many people live with undiagnosed high blood pressure, diabetes, or cholesterol issues until a stroke strikes. By visiting your doctor regularly, you can identify and treat these silent problems early. Those with a history of transient ischemic attacks, heart disease, or strong family history must be especially vigilant. Prevention is not about perfection but persistence. Each choice you make, each meal you adjust, each step you take adds to a protective shield around your brain. Stroke may be one of the leading causes of death and disability, but it is also one of the most preventable. Your health is shaped not by chance, but by the actions you take today. By controlling your risk factors and committing to a healthy lifestyle, you give yourself the best chance of a long life with strength, clarity, and independence. Doctor's final words. As a neurologist, I want you to take away one simple truth. Stroke is not an unpredictable accident that strikes without reason. In most cases, the warning signs are there, the risks are known, and the opportunities for prevention are clear, yet too often, people dismiss the dizziness, the slurred words, the sudden weakness, or the brief loss of vision as minor inconveniences. They wait for the symptoms to pass, and in doing so, they waste the chance to intervene before disaster strikes. A transient ischemic attack, even if it lasts only minutes, is not a harmless episode. It is your brain crying out for help, warning that blood flow is unstable and that a full stroke could follow. The golden hour of treatment is real, but it can only help those who reach medical care in time. That means you must act immediately at the first sign of trouble. Do not wait. Do not drive yourself. And do not assume it will resolve. Call emergency services and let professionals begin life-saving care right away. But the real power lies in prevention. High blood pressure, diabetes, high cholesterol, smoking, alcohol, poor diet, and inactivity are not abstract concepts. They are daily realities that build silently until one day they erupt into a stroke. Each of these risks can be reduced, and every small step toward healthier living lowers the chance that you will ever face this emergency. Think of prevention as an investment in your independence. It is not just about adding years to your life. It is about adding life to your years, preserving your ability to speak, to move, to remember, and to share moments with those you love. I encourage you to reflect on your own habits right now. Are you monitoring your blood pressure? Are you making time for exercise? Have you quit smoking or reduced alcohol? Are you eating foods that nourish rather than harm your vessels? These choices are not trivial. They are the building blocks of a future without stroke. Share your thoughts and experiences in the comments, because your story may be the warning or the encouragement someone else needs to change course before it is too late. Remember this above all: stroke can take everything in a matter of seconds, but prevention and quick action can give you decades of clarity, dignity, and independence. Do not wait for tragedy to force you into change. Start now. Protect your brain and choose health today, while you still have the power to decide.